Elevated LDL cholesterol is widely accepted as a key modifiable cardiovascular disease risk factor, yet more than half the population in most Western countries has cholesterol levels higher than desirable. Many dietary factors affect LDL cholesterol levels, but the single most effective way to lower them with dietary change is to include plant sterols or stanols. This fact is supported by a wealth of scientific evidence, which has recently been independently evaluated and approved by the European Food Safety Authority as strong enough to support one of the first disease risk reduction claims in the marketplace. A daily intake of 2 grams is clinically proven to actively lower cholesterol by up to 15% in 3 weeks, when combined with the move to a healthy diet and lifestyle. But just how much is needed to achieve the maximum lowering effect? There is a continuous dose-response relationship between the intake of plant sterols and their effect on LDL cholesterol levels. The more plant sterols consumed, the greater the reduction in LDL cholesterol, but only up to about 2 to 2.5 grams of plant sterols per day. Intakes above this level are not recommended, as they provide little further benefit. Indeed, both national and international dietary guidelines for heart health now recommend the inclusion of up to 2 grams of plant sterols per day. Let's take a look at how plant sterols work and where they come from. The key benefit of plant sterols lies in their ability to reduce the absorption of cholesterol from the gut into the bloodstream by 30 to 40%. Plant sterols have a similar chemical structure to cholesterol, and it's thought that when they reach the intestine, they displace cholesterol from the micelles and block its absorption from the intestine into the blood. This results in a reduction in total and LDL cholesterol, with no significant effect on HDL cholesterol or triglycerides, which means the ratio of total to HDL cholesterol is improved. So where do we find plant sterols? They occur naturally in everyday foods like vegetable oils, nuts, seeds, grain products, fruit, and vegetables. But the average daily intake of plant sterols from regular foods is very low, at around 0.3 grams per day. Even diets that contain plant sterol-rich foods in abundance, such as vegetarian diets, provide just 0.6 grams of plant sterols per day. As you've already heard, the optimal intake of plant sterols for significant cholesterol lowering is 2 to 2.5 grams per day, so you can see straight away that achieving this intake via regular foods is highly unrealistic and impractical. Your patients would have to eat 425 tomatoes or 150 apples every day. So this is why recommending plant sterol-enriched foods, such as Flora's Proactive Cholesterol range, which includes spreads and yogurt mini drinks, makes good sense. They contain plant sterols which are clinically proven to actively lower cholesterol by up to 15% in 3 weeks, when combined with the move to a healthy diet and lifestyle. Consuming 3 portions per day of Flora Proactive spread or just 1 yogurt mini drink will provide your patients with the optimal daily intake of 2 to 2.5 grams of plant sterols. For best results, because of the way plant sterols work, these foods should be consumed with a meal. Patients with elevated cholesterol